Stay tuned to this episode of 50 Shades of Pain where we're going to
get my knees finally treated! Yes!
Happy Halloween!
Happy Halloween!
Welcome everybody. This is our 50 Shades of Pain show where we empower patients with knowledge that demystifies pain and helps you get your problems on a track for repair as opposed to just numbing it and letting it deteriorate. And today I'm here with my co-host, Dr. James Escaloni. I'm Dr. Donish, Medical Director of Wellward Regenerative Medicine. And Dr. Escaloni, what did we reveal last week with your knee?
We figured out that I've got some deeper MCL and coronary tears and a biceps femoris tear, including there's blood vessels growing into it, making the scar better in a bad way. It's about time to kill this thing.
So to translate that, so knees are held together like this, and there are some ligaments that wrap around it, and between the two bones, the two main bones of the knee, there's a cushion called the meniscus. And in James' case, the meniscus is fine, but the ligament that surrounds the meniscus is not. And so it was just a matter of time, if this wasn't addressed, that you would move in a certain way and it would catch the meniscus off its guard and tear it. I think the fact that you work out so often and you're so strong, don't let it get to your head, is the reason why you haven't had a meniscal injury, is because everything else around it has been maintaining strength. But you notice that when you do a deep squat or a really heavy weight, that's when it hurts. And I suspect that's because the coronary ligament is not holding like an archway. It's like one brick is missing, so the whole thing collapses. And if it's getting sandwiched by those two bones, it's going to hurt, and eventually it's going to tear. So what we're going to do today is actually inject into that, along with some of the other structures that have gotten weak and have become a chronic problem, by evidenced by how many blood vessels and other things are growing into that area. We're going to try to disrupt that so that the scar tissue breaks down and his body's able to recreate new tissue. What we're going to do today is something called prolotherapy. It's a very long history of a technique where instead of simply suppressing inflammation to get rid of pain, we're actually leveraging inflammation. Inflammation is the way your body repairs, or it's the mechanism by which your body creates awareness that there's damage and needs repair. So we're going to leverage that, and just kind of like we're pruning a tree or painting a picture, we're going to target our colors and our shearing in the spots that need it, so that the body becomes aware that there's damage there. So, Dr. Macaroni, we're going to take a quick look at your meniscus and your coronary ligaments again. Unfreeze this. And I'm going to hide your face so that people don't see you grimacing, and just so that I can get a better visual on where we're looking. So here's the coronary ligament. If you guys can see that, you can see that black area is a little bit of swelling around it, and I am just going to clean this area off, and just to reflect, that is where your knee hurts, correct?
Right there, especially
Back there.
A little further back. Oh yeah, there's the spot.
So yeah, so that's where it looks like you have a small tear in the medial collateral ligament as well. So we're going to target both of those as I get more into that space. So I'm going to start with the coronary ligament here, and then move towards that medial collateral. All right, you're going to feel a little pinch. Ready? 1, 2, 3. Good job. No crying, James. There we go. Yeah, I know that's going to hurt a little bit. as we do this, it's going to go more and more numb. See where I'm spreading that into that coronary space. And inflating that a little bit.
Why is inflating good for you to diagnose things?
Well, we're trying to break up some of the scars that have developed and perpetuate weakness in that area. So what this does is it breaks up some of that scarring, and it incentivizes the body to bring in resources to help repair it. How bad's the pain, James?
Actually, not bad at all right now. A little sore right there.
Yeah, it's most of the coronaries that I wanted to hit. I'm going to back up a little bit higher. Okay, and then the other spot is the medial collateral ligament up here. This might be a little sore, James. You doing all right?
Yep.
You see me spreading those fibers right there. You're doing great, James. We're almost done with this.
Yay.
See all that swelling? Some of that is from me, but
You can see how that pulls apart the tissue.
yeah, you see, like, this is healthier tissue. It doesn't really expand as much as when I was over here. See how that expanded?
Yeah.
That's a little bit more damage in that area. I'm going to follow that medial lateral ligament down a little bit further. Yeah, that's the second one, I know. See, that's a little bit more torn right there.
Yeah, definitely.
Yeah. You're doing great.
Thank you.
For all the times he inflicts pain on me during exercise, my turn to return the favor. Yeah, it looks really healthy actually down here. It's not spreading at all. Actually, yeah. All right. So the other spot we wanted to hit is the biceps tendon. You doing all right?
Yeah.
How's the pain on that?
A lot less than I thought.
Yeah. And this is the guy that's really looking ugly.
Great.
There's a lot of blood vessels. And, you see all that? Those pulses in there. Those are the blood vessels that have grown into that tendon. And clean it up a little bit. And here comes another pinch. Ready? 1, 2, 3.
Sore.
Yeah, that's going to be sore. Now, after this, what I'm going to expect is I'm going to be sore for a few days. Typically, the worst of it is within the first 12 hours, and then you get a step off in the pain. But for the first 48 hours, I expect to see a little bit more irritation and pain, just as how anytime you have an acute injury, you have swelling and discomfort. In the first 48 hours, that swelling is going to be at its worst. That's going to recruit all sorts of really good nutrients and cells that do repair into that area. And over the next 2 to 3 weeks, those guys are going to set up shop. So now I'm just peppering that tendon. How's the pain now?
It's pretty good.
Yeah,
Not
so
too bad at all.
as I do it, it's going to keep numbing it. So over the next 4 to 6 weeks, those cells that have now been recruited into the area to do some of this repair will get active and do that, initiate that repair. Prolotherapy often requires a repetition. It's not a one and done like PRP or stem cells are, so we may need to repeat this a couple of times, and depending on how you recover from each one of these, we'll decide if we want to move forward with just prolotherapy or if we need to step up the game to a PRP. I don't think, I'd be very skeptical this needs any kind of stem cell therapies, but it could need some PRP, just given the fact that the tissue spreads so much and there's so much blood vessels that have grown into that area.
So we're done?
That's it.
That was it?
That's it. You were shaking like a leaf.
I was practically crying earlier because I hate needles and I've never had an injection, no cortisone, nothing before. And I see him like preparing these needles and I'm like, worst possible thing. That was nothing. Good job.
Well, I didn't want to have you screaming on camera, so I was actually gentle. But I was really tempted to be, I've got one needle that I sharpen out on the sidewalk in the mornings. It's rusty, so I just have to, scrape it off on the sidewalk.
For that one patient who talks back.
Right, it's for that one patient who talks back, and I had it out. I was just waiting for you to be whining and moaning.
Oh, this.
I actually
honestly,
used a fresh needle on it this time.
This was a lot easier than I thought, honestly. Yeah.
Good.
First time ever. I'm not lying, guys. I was expecting a lot worse.
He was actually nervous about doing this.
Seriously.
Yeah. So, thank you for watching our 50 Shades of Pain show, where our goal is to empower patients with knowledge to demystify pain and put you on a track to repairing injuries as opposed to suppressing them. Please feel free to send us messages. Find us on our website, wellwardmed.com, where you can tune in every week where we're going to do a broadcast of some topic around pain and what we do and how our goal is to really have an impact on all of healthcare and how we approach pain issues.
Yeah. Message me on social media if you want. I'll tell you how this is going.
Yeah, so Dr. Escaloni or Macaroni will keep updating us on how things are progressing.
Yeah, just send a message to the Wellward Facebook page, the Instagram page, any of those things. We'll get back to you.
Yep.
All right.
I'm Dr. Donish,
I'm Dr. Escaloni.
and we'll see you soon.